There has certainly been groundbreaking advances, I guess, since the past decade or so. As a transplanter or starting from a hematopoietic cell transplantation, this is a curative treatment, but the burden of toxicities is quite substantial. And I feel like one major progress we have with cellular therapy and immune effector cells is the fact that the toxicity is more limited, although it's still there and we still need to deal with it. It's not as substantial as we see in transplant. And the fact that you can get some patients even cured with a single infusion is quite remarkable. But I think still we have a long way ahead of us, specifically if we're focusing on lymphomas and a challenge of relapse and progression after CAR T cells. So approximately in large B-cell lymphoma, about 50% will ultimately relapse or progress after CAR T, even in second line when giving CAR T earlier treatment. So I think that should be our focus for the next couple of years, to target that population and reduce relapse and relapse rates to essentially nil.
There's so many different things that are currently ongoing. That is meaning overexpression of key factors. It is inhibition of those that are making CAR T cells worse. It is looking at the microenvironment. And I think there's so many different aspects. We also do see at the EBMT meeting what the future is holding for us, and I'm very excited to see what makes it to the clinic and what is making patient life better. It's actually a very exciting time to be in the field because there's so many approaches that we can take, from manipulation of the cell itself, for looking at the tumor microenvironment and adapting cells engineered to that. There's so many possibilities. I'm very excited to see what will end up in the patient and what makes their life better. CAR T cells have been demonstrated to be very effective in cancer, but to look beyond cancer, that is almost even more exciting, because manipulating immunity in case of autoimmunity or inflammation is very hard. It's hard to understand. But to engineer a T cell that can adapt to these environments as well, I guess that will be the key goal, as there's so many people suffering from non-malignant diseases as well. I guess there's so many great examples currently showing that there is a promise to keep them that.
Artificial intelligence is now involved in almost all aspects of our lives. And I think in medicine, we're kind of lagging behind. I feel like there are a lot of opportunities, specifically in cellular therapy, to incorporate AI. So starting from the actual development of the treatment, epitope discovery, optimization of a CAR T cell manufacturing, to the actual infusion of the drug or the treatment, and trying to optimize the population that we give cellular therapy to. As we noted earlier, there is great variability in the response rates to CAR T cell therapy. And using AI tools, I feel like we could probably personalize this treatment, find patients that would benefit from specific types of cellular therapy, and maybe integrate consolidative treatments specifically for high-risk populations. So AI could help us sort of refine that population and be incorporated into decision support system to optimize patient care. My research is focused on integrating multiple modalities in cellular therapy to predict outcomes of patients undergoing CAR T cell therapy. And the type of modalities that we're using is sort of standard clinical tools that we have available, whether it's a clinical chart, radiomics, or PET scans, genomics. And using machine learning and AI, I try to integrate these different modalities and try to foresee what will be the course of a specific patient. Based on these models, we try to tailor our interventions for these patients. So, for instance, identifying high-risk populations and trying to propose certain drugs based on what we know from these modalities to these patients that would augment or improve the outcome in these specific populations. There are many challenges of implementing AI in research and in clinical medicine, I think one of the major barriers is the fact that for many of these machine learning algorithms or AI algorithms, we need large data sets. And typically, a lot of these data sets are siloed at different institutions, or even within in each institution, you can have different branches, and sort of getting all the data together actually takes a lot of effort. So to me, we should focus on collaboration and extending our available data to really make use of these technologies that we have. Other challenges are related to model interpretability. So many of these machine learning models are in fact black box models, and we cannot understand the rationale behind a certain prediction. That being said, there are tools to explore post hoc different models and sort of understand some of the features driving prediction.
Looking at the microbiome as part of the immune environment is very important. Also, the tumor microenvironment plays a very important role, as we see from CAR T cells not really engaging in patients as they should do. And I guess to tackle these very dynamic systems, we need to work together with different fields, different consortia, interdisciplinary, looking at standardized methods to collect samples and to analyze them. And hopefully, if we do that very well, we find a solution for these issues.
I'm very excited about the opportunities we have to expand cellular therapy beyond malignancies. I feel like autoimmune disorders, infectious disease are developing fields which the tools that we had developed in hematology would actually expand and improve the lives of so many other patients, even curing some of these sort of chronic disease that we thought previously uncurable.
I'm very excited, as there's so many different routes that are going on, even in the preclinical area. And I guess the most exciting thing for me is to see what of these aspects will make it to the clinic and which ones will be those that are also helping the patient, and what can we learn from that. I guess there will be a bench to bedside approach and back, and yeah, it won't become boring at all in the next few years at least.